Hi, this is Krista Williams, and we're going to do the head-to-toe assessment for Health Assessment 2. And we're going to go ahead and get started. First, I would say, hi, I'm Carissa. I'm going to be your nurse today. I would be performing hand hygiene at the same time. And then I would ask you if you were feeling any pain. Are you feeling any pain today?
No.
Are you allergic to anything before we get started? Okay, good. I'm going to check your wristband. Can you tell me your name and your date of birth?
Diane Williams, February 23rd, 66.
It's good, thank you. Okay, so I introduced myself to the patient and I made sure I did the patient identifier so I know who she is. I want to make sure it's the right person that's in our office. Okay, next I'm going to ask you A&O times 4. So I'm going to ask you person, place, time, and situation. So can you tell me who you're here to see today?
Krista Williams,
All right, can you tell me where you are?
Highland, Illinois.
Why are you here today?
To have an overall health assessment,
Okay, can you tell me the month and the year?
April 2020.
All right, thank you so much. She's A&O times 4 because she was able to tell me all those things. I would also take a good look at her and make sure that her appearance matches the weather outside, it's weather appropriate. It is because it's pretty warm today. Her gait when she walked in was normal and it was good. She's alert, she's sitting upright, she has good posture, and she's appropriately responding to my questions. Okay, next I would perform vital signs. Today we have a little toy stethoscope because mine is somewhere, and we were cleaning up my house, so I don't know where mine is. Okay, so we're gonna do this. We would do vital signs. So we would check at her brachial artery for blood pressure, and she would have a blood pressure cuff, and I would be listening for 30 seconds. Well, no. I would be having the thing on there. If I was checking her pulse, I would do it for 30 seconds, usually at the radial. I would do that for 30 seconds, so I would check her pulse. I would do this, the brachial artery, and I would have my blood pressure cuff, and I would pump it up. And I would listen to the systolic and dystolic. I could also do a pulse oximeter on her, which would be the finger. It should be between 95 and 100. That would also be part of her vital signs. And I don't have my thermometer with me. There's probably one in here somewhere. We've got a fancy thermometer here. It's a laser temporal one. I'm gonna turn it on. She's 96.9, which is in normal range. She always runs kind of colder. That's my mom, I know. And that would be all of her vital signs. Okay. Next, we're going to do skin and nails. So we're going to make sure her skin color is appropriate for her ethnicity, which it is. It's even. I don't see any lesions anywhere, any bumps or bruising. I mean, there's a little bump right there, but that just looks like kind of a bug bite or something. There's none on her face. I don't see any on her legs because her legs are exposed. She's got a small little mole here. But other than that, her skin is all the same color, and there's not many other skin markings on it, which is good. No bruising, no bumps, bruises, scrapes. All good. It's all even. And now we're going to do your capillary refill. So I'm going to check your nails, and it should all be less than 2 seconds. That's good. I also noticed that there's no clubbing in your fingers. It is at the 160 degrees like it's supposed to. That's good. So your hair and skin and nails are good. So now we're going to do your, we're going to start at your head and we're going to check your hair. Make sure that there's no lesions, no infestations, your scalp's the right shape and your skull's the right shape, and make sure everything's in its place. So I don't see any infestations, no lesions. Her hair color is all the same, it's distributed even. Her head is all the right shape that it should be. Her face is even. Her bone structure is even, her nose is in the middle like it should be, her eyes are at the same level. So next we're going to do some of the facial cranial nerves. So first we're gonna test cranial nerve 5. We're gonna do the sensation. You're going to have something that's really soft and you're gonna drag it down their T-zone of their face. And you're gonna have them say now when they feel it. So close your eyes. You say now.
Now, 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 now.
Okay, so that part of our cranial nerve 5 works, and then can you clench your teeth together? Okay, and I can feel all of our muscles in there are as they should be. So that's cranial nerve 5. So now we're going to do cranial nerve 7. This is your facial muscles. So can you raise your eyebrows? Can you smile? Can you frown? Good. Okay, next we're going to do parts of your neck. So first I'm going to check for jugular vein distension. Can't really do it right here. Normally she would be back 45 degrees, but can't really do that. But if I would have her lean back that way and I could measure it if it looked like there was anything going on. But there's not, so there, that is. I could also check her lymph nodes in her face and her neck if I wanted to. Be preauricle, post-auricle, some cervical ones here, occipital ones, which none of hers are swollen or anything, and they should not be able to be palpated, and it should be, and if you kind of do, it should be soft and movable. Oh, you're okay. She's got a little bit of a cough. Okay, so, and now we're going to check your cranial nerve 11, which is raising of your shoulders against resistance. So can you move that up? Okay, good. We're also going to check your turning of your neck. So can you push against my hand? Okay, push against my hand. Good. Can you turn your head? Turn your head. Can you look up? Look down? Good. Okay, now we're going to move on to eyes. I do not have my pen light because also my son displaced that. So normally you do your pen light, and we're going to check for Perla. Your pupils are equal. They are round. I would put my eye, I would be like this, my flashlight over it, my over it. They should constrict consensually together, and that would be, they are reactive to light. Now we're going to do the accommodation part. You're going to stare at this as it comes towards your face. Good. They're working together. Okay, we're also going to do the 6 cardinal positions, fields of gaze, to check 3, 4, and 6 cranial nerves. Okay, so you're going to stare at my pen and follow to the position that it goes, okay? Good. Good. She was able to do all those, so all of those cranial nerves are in operation. Okay, now we're going to do ears. I would normally have a pen like this. You'd pull the pin up back. You'd look in, make sure there's no swelling, no discharge, no redness. Are your ears hurting at all?
No.
Your ears hurt at all? Do it on this side too. No discharge or just no swelling. They don't look good. Doesn't seem to be any lesions on the outside. I noticed you have a piercing on each side. Next we do the whisper test, which is cranial nerve 8. My mother is deaf in her left ear, so she will not be able to probably hear that. She may or may not, depending on the loudness of the whisper. But so to test that, since I already know it, you would go around the side and you would say, red car. And then you repeat that to me.
Red car.
Oh, look, she said that. She got it.
I'm just guessing.
I whispered pretty loud, though. I'm not a very good whisperer.
Blue hat.
Okay, blue hat. So there you go. She can hear it, and that helps me understand that she can hear me. And also, I mean, I talk pretty loud, so based on the conversation, she can hear me. But if sometimes people don't talk as loud as I do. Okay, next we're going to do nose. You would use a pen light for this as well. You would look for septum deviation, if there's any discharge, any redness, any polyps, any of that sort. I don't see any. You can check nasal patency. So you're going to put your finger on one side of your nose, breathe in, and now do the other side. Good. Nasal patency works. It's all good. Okay, now we're gonna do mouth and throat. Once again, you'd use a pen light. Can you open your mouth for me, please? I'm going to check. I don't see any sores, any bleeding or anything. Your teeth look good. You got some previous fillings in there. Your teeth are in good condition though. Your gums are pink and moist like they should be, same as your tongue. And then you can check cranial nerves here too. Be 9 and 10. You stick your tongue out and you're gonna say ah.
Ah.
Okay, and then can you stick your tongue out further? Can you wiggle it around? Okay, so cranial nerve 12, the hypoglossal one, she can move her tongue. Okay, and I already did kind of, well, I mean, the inside of the throat, but also with this. I don't feel anything. I can check her carotid simultaneously, not simultaneously, one after the other. Okay, and now we're going to do respiratory. So like I said, toy one, so it wouldn't be for real, but you shouldn't hear anything other than normal breath sounds, just breathing. Okay, I'm going to move this 6 spots in the front, 6 spots in the back, and can you take a deep breath in and out with each movement? Okay, does everything understand? So this would be right upper lobe, left upper lobe, right middle lobe. This would still be part of the left lower lobe, right lower lobe, left lower lobe. Okay, can you spin that way? I'm going to do your back. Okay, this will be left upper lobe, right upper lobe, right lower lobe, left lower lobe, left lower lobe again, right lower lobe again. Okay, so that was all of her respiratory. She had no problems with her breathing. I can see that she's in no respiratory distress. She's not looking anxious. She's not getting restless. She's not, her chest isn't rising, falling, or going too slow. It's at the appropriate amount. I could, while I was taking her radial pulse, I could have just pretended to keep doing it a little bit longer, and I would actually have watched her respirations and her chest rise and fall, and I could have counted those, and that would be part of vital signs as well. Okay, we're going to use this again. We're going to do cardiovascular. First, I'm going to check all of her pulses. So you do her radial pulse.